You're watching Cetome TV. Knowledge is power.
Okay, Francis was wondering, what are sensitizing and desensitizing mutations, and why are they important? Good question, Francis.
Yes.
You've obviously been watching some of Alex's videos or something to be asking this question, but that's excellent.
So a sensitizing mutation is a mutation that confers sensitivity to a targeted therapy or an immune therapy even a chemotherapy drug.
Makes it work better.
It is the target of that drug.
Okay. All right.
So, for example, if you have, a BRAF V600E mutation, then the indicated drug vemurafenib, or there's a few different ones now, but vemurafenib was the initial drug for that, will affect any cell in the body that has that mutation.
Okay.
A desensitizing mutation is a mutation that can occur in a targeted gene. So a classic example of a desensitizing mutation would be when patients with EGFR positive lung cancer have a mutation in the EGFR gene.
Mm-hmm.
When they're treated with an EGFR drug, there's certain mutations that are key to targeting, EGFR. And when patients are given a drug, after a few years, they develop sensitivity to these drugs. And the reason is because they get a secondary emerging mutation called the EGFR T790M. And so basically what happens there is this T790M mutation is a desensitizing mutation, whereas the original EGFR mutation was a sensitizing mutation and allowed the patient to get this drug, for a few years. Now they've developed a desensitizing mutation, and that prevents, what it does is it causes the protein to refold in a certain way so the original drug can't access what they call the binding cleft.
Right. So sensitizing mutations really kind of that's the target for the drug. And then if you have one of these desensitizing mutations, it means that your targeted therapy is going to stop working.
Yeah, but typically when they find an emerging mutation, as in with T790M, for example, if a patient's getting gefitinib for their original, or Iressa Tarceva, for their original EGFR mutation, then if they develop this T790M, they can take Tagrisso, which is designed just for that mutation. So it's a third generation EGFR inhibitor.
Okay, so the point is, there's whether you have the sensitizing or the desensitizing kind, there are things that can be done.
Well, you start with the sensitizing, and then you develop the desensitizing.
But there are treatments or options based on what's happening.
You want to be looking for a desensitizing mutation should a drug stop working.
Got it. You want to have a plan B.
Exactly.
Got it.
Thank you for watching Cetome TV. Subscribe below and stay informed.